for.
Okay, so I have a couple questions.
Yeah.
One, I didn't realize that SSRIs, depression medication, is used for anxiety.
Yes. I'm glad you brought that up. So a common misconception. The SSRIs, the selective serotonin reuptake inhibitors, they're known as antidepressants, but it's actually a misnomer because the SSRIs are absolutely the first line treatment for all anxiety disorders. When you're trying to treat anxiety disorders, you want to increase the serotonergic tone, how much serotonin is available in your brain. Now, these SSRIs, we're talking about like your daily medications. What we can get to later if you're interested, or maybe the audience is interested, is there's a whole other world of anxiety medications that we use as needed. These are your Xanax, your Ativans, your Klonopins. So there's a big differentiation between like the first line treatments for anxiety disorders, like your daily medications, versus like the as needed medications used in moments where your anxiety is so elevated you can't get a grasp on it.
Okay, that's interesting. Yeah, I thought Xanax and the Klonopin and the ones like that were for everyday use, but apparently they're not.
There are instances in which we will use medications like clonazepam, which is a benzodiazepine, for a daily use. But usually those, because they carry the risk of dependence, are utilized like once, twice a week.
Okay.
Yeah, as needed. Absolutely.
Yeah.
I mean, everything is individualized to the patient. So someone comes in, non-intrusive worry, perhaps a little bit of a delay in sleep onset, perhaps some other symptoms of clinical anxiety. Okay, we might start a medication like buspirone. It's not an SSRI. It's less potent than an SSRI. Fine, start there. How are you doing? So that's kind of the general flow. How severe is their anxiety disorder? If you're on the milder end, medications like buspirone. If you're on the more significant, moderate, severe end, SSRIs, likely at moderate, medium to high doses. And then usually we give patients like an as-needed medication for if they have a panic attack or some sort of like really elevated episode of anxiety that they can't regulate themselves.
And this secondary addition is a separate pathway of brain chemistry?
Absolutely. It's a different mechanism of action. Common examples are medications that are sedatives, gabapentins, Lyricas, benzodiazepines like clonazepam, Ativan. You have other medications that work on your sympathetic nervous system like guanfacine. You have atypical antipsychotic medications like Abilify. Now, this might be going over a lot of the audience's head. Those that are actively involved in treatment, this might resonate more with them. Point being, your serotonin medications are the first line treatment for anxiety disorders, and we have different ways of adding on other medications to attack whatever symptoms are not adequately treated with the SSRI.
And I would venture, I guess a lot of our audience has seen those pharma commercials, you know, you always see those Abilify.
Yeah, exactly.
Right, that's how I know these ones.
You know, that's a great name for a medication.
You know what?
Abilify.
They got some good marketing people.
Who doesn't want to be Abilified?
Yeah, exactly. Okay, so before we move on to our first written down topic, I just wanted to ask you real quick, why would you choose one drug over the other for anxiety? Does it have to do with the patient's symptoms that they incur from taking the drug, and then maybe you try a different one?
Yes.
Because of that? Like, how do you, because you name like 4.
Yeah.
You know?
Excellent question. So, hey, doc, there's like 10 different SSRIs, Prozac, Zoloft, whatever. Why are you choosing this specific medication? This is actually an interesting topic. When I'm talking to friends, casually about this stuff, this is always like a question they have. What is the difference between these SSRIs and what goes into selecting one? Now, this is also a reason someone will get kicked up to a psychiatrist rather than seeing, for instance, like a primary care doctor, right?
Yeah.
A primary care doctor, I mean, they do great work. A lot of the people that refer to me are primary care doctors, but they're not necessarily, and it's not their job to be super educated as far as like the nuanced differences of these SSRIs.
Can you maybe pick 2 separate SSRIs as an example, state the pros and cons of each and why you might transfer a patient over from one to the other? This is like an example.
Absolutely. So let's talk about like the oldest SSRI, Prozac. The generic name is fluoxetine.
We've all heard of that one.
So what are the pros and cons of Prozac? 1, Prozac lasts in your system a very long time. the half-life is very long, which means it might take a little bit longer to really kick in. But if you miss a dose, the levels of the medication in your blood are not going to drop precipitously, which means that if you miss a dose, you're not going to feel withdrawals, which for some people is a great plus. And with a lot of people, well, not many, a fraction of people, it's not necessarily the best option for them. And there's reasons why. We won't get into that right now. So Prozac, it's the most activating of the SSRIs, which means it switches people on. Now, it doesn't switch people on in sort of like a caffeine way or a stimulant way like an Adderall or a Vyvanse. It switches people on in like this serotonergic way.
How does that feel separate from a stimulant sort of?
I'll tell you. So now here we're in a bit more of a casual setting,
sure.
Although I do ask this question for my patients,
but I just want to know what to ask my drug dealer later.
Yeah. So speaking of which, now I ask patients, have you ever taken any sort of like psilocybin? Psilocybin works with your serotonin system amongst others. But if any of my patients have tried psilocybin mushrooms, I'm like, well, have you ever noticed that you're feeling more alert, more aroused, more activated when you're under the effects of this like serotonin agent, like this psilocybin magic mushroom? Now, the last time you took psilocybin mushrooms, did you feel sedated? Did you feel activated? Did you feel alert? How did it make you feel as far as like arousal and alertness? So patients that are coming to me with fatigue, hey doc, I'm tired, whether that's from like generalized anxiety, clinical depression, or anything else, Prozac, it's activating. You take it in the morning. It lasts in your bloodstream a while. Now, a lot of the traditional antidepressants, their half-life is 24 hours.
Okay.
What does that mean? That means after 24 hours after your last dose, the level of the medication in your bloodstream has dropped by half. So as you can imagine, that if you miss one dose and you're sensitive to withdrawal effects, you can experience withdrawals even after missing one dose. A lot of people tell me, hey doc, it's very inconvenient for my life to feel like I have to carry this medication with me everywhere I go. If I'm traveling, if I miss a dose, it doesn't feel good. It feels like I am somewhat imprisoned by having to take this medication every single day.
Okay, I can see that.
Prozac is a great option for patients that might miss a dose here or there, that are sensitive to withdrawal symptoms of SSRIs. It's forgiving. You take it once a day, every single day in the morning like the other SSRIs. But if you happen to miss a dose, not a big deal.
Okay, and then what if and then what's the other one where if they're cool with it and cool with keeping track of themselves every day and all that, then what's the other?
I will tell you that
option?
in a moment. Let me tell you the drawbacks of Prozac.
Okay.
Because it's an activating SSRI, you have to take it in the morning. Some people report overactivation side effects. They might get tremors. They might have insomnia. They might feel too alert. It's hard to wind down at night. So,
oh wow,
it's the other side of that coin. It's
okay,
the most
so
activating.
It is very affecting then. I mean, if you're getting tremors and you can't fall asleep at night and stuff, then that's quite strong.
Now, I will tell you, what percentage of people are experiencing these overactivation side effects of Prozac? Maybe 2 to 5%.
Okay.
Rare. It's all about, with Prozac, because of these overactivation side effects, you start low, you go slow, and you alert the patients as to this potential side effect. You know, the last thing you want to do, because, you know, Prozac is so robustly effective in treating anxiety disorders, but the last thing you want to do is give someone that's anxious a medication that might overactivate them without alerting them of the potential side effects. Now, here we have Prozac. Long half-life, forgiving, you miss a dose, fine. Oldest SSRI, tons of evidence behind it. Might be my favorite SSRI. Activating, if you're feeling a little fatigued, all good. This will perk you up a bit. Once in the morning, done. Now, the other end of that spectrum might be a medication like Paxil. Paxil is somewhat sedating. You have to take it at night. I rarely use this medication. I'll tell you, if people are interested in why I'm not a big fan of Paxil, they can ask me in the comments. But that is on the other end of the spectrum. It's not activating, short half-life. So, if people are having insomnia and you want to parlay the sedating effects of Paxil into try to helping them sleep at night, okay. I literally can't remember the last time I started a Paxil, but just to highlight the differences between a SSRI like Paxil that might be sedating versus an SSRI like Prozac that's activating, that's the only reason I'm really bringing Paxil up.
Okay, so just to sum it up, as I understand it then, so certain SSRIs have an activating tendency. They'll amp people up throughout the day. They'll turn them on. But there's other people with anxiety that are already too on. They might not need quite that much activation. They might have more trouble sleeping. So maybe a separate SSRI that acts more as a sedative might be good for them. They're both SSRIs. They both treat anxiety. But for the individual patient, you have to do the figuring out of what to actually get them. Yeah.
Now, here's a little kind of tidbit for everybody watching. All SSRIs have the same effectiveness in treating anxiety and mood disorders. So they're all just as effective in treating anxiety and mood disorders. So where the nuance comes in is the side effect profile.
Tailoring it to your own life.
Exactly. Not to mention, if you want to get more nuanced in a patient that's on different medications, some of these medications have interactions with other medications. And this is where that extra layer of being a psychiatrist comes in.
Yes.
Yeah.
I can imagine that's just an entire field in and of itself is managing the reactions between different medications.
Yeah.
Is it medications even that have nothing to do with mental health, like blood thinners or something like that? Yeah.
Without question.
Yeah.
Now, that's another reason people often get kicked up to me, especially from their primary care doctor. People that are on a variety of different medications for a variety of different reasons, blood pressure, they have some sort of clotting issue, cholesterol, birth control pills, you name it. When people are on multiple different medications and they're worried about interactions between their psychiatric medications and these other medications, that's also an indication for kicking somebody up to see a psychiatrist. Medication interactions with psychiatric medications.
Makes perfect sense.
Super, super important.